we are committed to starting a new initiative, opening a community healthcare center in New Jersey.
Joining us today is the President, Dr. Tushar Patel, and the Chairman of the Board of Trustees, Mr. Kiran Kothari. Hi, so thank you for joining us at Community Spotlight by Vibrnz. So HCNJ has been serving communities since 1998. What inspired the creation of HCNJ and what gap were you looking at when you started this for the first time?
So it really started because if you recall in the 90s, a lot of the parents of the who were, the kids who were here, their parents were visiting and they did not have insurance. And now they were staying here almost a year, 2, 3, and maybe some are permanently here. So what we noticed is they do not go to a doctor because they do not have insurance and they do not even get a regular physical. And so it became obvious to us that we need to do something so that they have an opportunity to at least get some screening done. And so that was really the main reason the whole organization, the activity started. And it started in 1998 when we started. Clearly, it was just a group of friends who thought about it. And our pioneers had a dream of really creating an opportunity for individuals without insurance or those who are even uninsured within our community to have a proper comprehensive screening. So the first camp was at the Ved Mandir in Milltown, and we did not know who will show up, how many will show up, who the doctors will be, who the nurses will be, and all the volunteers. As it turned out, I always say this, when you're doing some good work, angels show up. Well, we had many, many doctors, including Dr. Tushar Patel, and many nurses came, and many were like over 100 volunteers showed up. We had over 150 or 200 patients, right, Tushar? And it went really well. It was very crowded in that temple, but everybody who came, we realized that this is a serious necessity because the abnormalities we found, diabetes, blood pressure, and in some cases, a little bit more serious. So then we said, okay, this is something our community needs. Let's keep doing it. And so then we started from 1 to 2 camps, and then we kept on increasing. So if you go fast forward to last year, we saw almost 800 to 1,000 patients, and we have been doing it. So that's how the whole concept started, and it evolved, and more volunteers came through and helped us. And it's been a phenomenal journey for Health Camp of New Jersey. We started as Indian Health Camp of New Jersey. Now we are a Health Camp of New Jersey because we want to attract all communities to come to us and take advantage of this screening process.
Amazing concept. And you have grown so significantly since then, right?
Yeah. Tushar, you want to add something to this?
Yeah, so first of all, thank you so much, Mini and Vibrnz, for our community partner in the media and promoting our events for the past few years. You have been a key role in our success for the last few years in the digital world, and we are so thankful to you for the partnership. I just want to add one more thing that whatever Mr. Kothari said is wonderful, and I think the idea was not to treat an illness but to focus on prevention, identifying the chronic disease earlier to prevent long-term complications and even in some cases death. So I think the overall idea was to promote early screening, which were lacking in our community.
So for someone hearing about HCNJ for the first time, right, how would you describe the impact your health camps have made in the community?
So I'll answer that. So the impact has been very meaningful and also measurable because we can tell from the last 27 years, we have screened almost 15,000 individuals and identified more than 4,500 chronic disease abnormalities. So it's definitely measurable. Also, our health camps provide almost free screenings to about $1,000 per person's services under one roof. So we do blood tests, EKG, cancer screening, and all comprehensive health screening. So and the impact is huge because, as you know, if you diagnose diabetes or a heart disease or a cancer on an earlier stages or earlier disease stage, the long-term complications are reduced tremendously, and also the treatment works better when you have the diagnosis done earlier. So impact is huge, and our focus is not only the screening but also providing the education and counseling. We tell them how to control their diabetes, because medications sometimes work 50, 60, 70%, but patient has to do some of their own part, about 25-30%, and if that doesn't work, medication doesn't work. So the impact of health camps for the past this many years is tremendous.
If you think in dollars and cents terms, Dr. Patel mentioned that each screening would be worth at least $1,000. Multiply that by 15,000 patients. That's the kind of service that this organization has provided to our community.
Yes, yes.
Yeah, and also one more thing I want to add. My physicians community, my brothers and sisters who are the primary care providers or the physician community surrounding New Jersey, they don't have much time in spending time with the patients for the education, telling them about their medication side effects, and so many other things which requires. That gap is being filled by the Health Camp of New Jersey for these many years.
So during your health camps and screenings, what are some of the most common health issues and conditions that you come across?
So the most common one, diabetes, hemoglobin A1C on roof, almost 15, 14, 13. Normal should be 6.5, 6. So hypertension, cholesterol, obesity, cancer. We have diagnosed some cancers, eye care, vision-related issues, and so many other chronic conditions, including mental health, is a huge problem in South Asians. And it's a huge stigma in our population that they don't like to talk. And we have seen so many patients at the health camp during mental health programs where the stress, anxiety, depression are becoming increasingly common in our population, and they don't have a conversation channel to release that stress, release that depression, and get some education for the chronic mental health conditions as well.
Yeah. And do you have any specific organizations for mental health or issues that people are, going
Yes. So we collaborate with so many organizations throughout New Jersey. Community organizations are our partner. For mental health, we have an organization called SAMHIN, South Asian Mental Health Initiatives and Network. They provide tremendous services for the mental health patients without any money. It's zero finance. There is no reason for anyone to pay, even look for an insurance card. They provide free services through Health Camp of New Jersey and their own SAMHIN networking. So it's being very, very well-oiled machine we have, where patients can get all the resources and services without worrying about too much financial burden on their families. So one example is SAMHIN. The other example, our local community hospitals like RWJ Barnabas Somerset. Last year we had a collaboration with Hamilton. Now this year we are doing collaboration with New Brunswick. So 3 major network will be our collaborator for the Health Camp of New Jersey health camps in 2026. So it's been going very well. Also in Princeton we have an organization called Penn Medicine Princeton, which is they also provide the services at our health camps.
Okay.
Kiran,
I can give you an example of how these collaborations work. And this will give you a live example of something that happened at one of our camps at Balaji Mandir in Bridgewater. One of the priests who came because they don't have insurance, so they came for a screening. And our process is we do blood test first and the little breakfast, and then we do EKG. As soon as the EKG technician took the EKG, they saw abnormality. They immediately took it to cardiologists who's part of our health camp network. They were there, they looked at it and they said, you need to immediately go to a hospital. And RWJ Somerset was around the corner. We sent him there and immediately he was treated. That's how well the collaborations work. And because of that, I mean, he feels that he has a second life because of what we, found out on that day. This is how what our services work and as well as our collaborations work.
So impressive. This is a great example you just gave, but that was my next question. Is there any particular story or experience from work that you would like to share, maybe about a patient that you would like to share with the audience?
Yeah, so I'm gonna answer that. Over the years, there have been many moments through the health fairs that why this mission is very important. Someone comes with a health camp thinking they are perfectly healthy, but a screening reveals that something is serious happening to them, either very high blood pressure, extremely high blood sugar. We have seen patients with close to 500 sugar when they walk in. It's like a walking time bomb. In some cases, we suspected cancer, diagnosed cancer during the health fairs. So potentially life-threatening conditions have been diagnosed at the health fairs. We have a list of patients who were diagnosed with breast cancer, cervical cancer, prostate cancer, so many chronic eye conditions which we diagnosed, heart condition like Mr. Kothari mentioned that a priest from Bridgewater had bradycardia, he needed a pacemaker, he was sent to RWJ Somerset, and he got the treatment. He was supposed to fly to India 3 or 4 days after the health camp. And so I think that's a perfect example of saving someone's life through just the health screening. So I think people need to understand that health screening is very, very important. Early diagnosis, early detection definitely reduce long-term complications and save lives.
You already talked about collaboration, partnerships. So HCNJ brings together doctors, volunteers, health professionals, service professionals. Talk about the importance that this community support has in running your organization.
Yeah, so when you do, we all very strong individually, but when you collaborate with the local institutions or the organizations, your strength becomes very wide. You get a lot of services, a lot of resources from them. If you are individually strong, you can reach 10 people or 100 people. By doing collaborations, you reach thousands of people, and that's what we have been doing. And like I mentioned few names already, RWJ Barnabas, but we also have I also mentioned about Samin, but there is a hospital in Secaucus area, Hudson Regional Health Center. They are our key partner in North Jersey area. So LabCorp, for an example, they provide a very reliable and very reasonable cost blood test services for the health camp of New Jersey for many years. Previously, it was our own good friend, Mr. Rupen Patel. He owned Accurate Diagnostic Labs. Then he sold his lab to LabCorp, and thank God they are still collaborating with us. We are getting the service from LabCorp. And like I mentioned, is about $300 to $400 per patient we spend on the blood test, which we only get a negligible amount of bill from them. So it is very, very important that we're getting the community collaborations. One other collaboration I want to mention is the New Jersey State Commission for the Blind. It's a preventive blindness program in the state of New Jersey, where we get the screening from the New Jersey state, and if anybody needs any further follow-up, they do it without any charges. So it's very, very important that community outreach and the collaboration plays a key role in our Health Camp of New Jersey continuous program.
Yeah, let me add the volunteers side of it. These are the organizations who we collaborate with, but the volunteer physicians, nurses, and just in general volunteers. We have high school students who volunteer at every camp we have. They are so important to us because doctors, nurses, and all these hundreds of volunteers we have, they really provide the service at no cost, of course. They are passionate about helping our community members who do not have insurance or if they are underinsured. So together, what we are able to do is reduce the difference between those who have the insurance and those who do not. So that really helps. And these volunteers are really our key members who have really helped us so much over the years. If you count the number of hours they have spent, it's in thousands and thousands of hours of these volunteers. And we really, really appreciate that support from all those volunteers.
Definitely. So from the time you started in 1998 and where you are now, you've grown significantly, right? And you've done so much more. Every year you've done so much more. And now, as I understand, you're expanding to build or open an outpatient community health center. So please share your vision, and I'm sure you all are very excited about it.
Yes, so this is an exciting and important next step for Health Camp of New Jersey. While health camps have been very impactful, they are periodic events, right? You can do more than 4 or 5. Last year we overachieved. We had 7 health camps last year, but that took a lot of stress on many physicians and the volunteers. And we realized that many individuals need ongoing care, right? Because if we identify some abnormalities, care is very important. So it's not just one-time screening. So our vision is to establish a community-based outpatient health center that provides affordable, accessible, and culturally sensitive healthcare services. This will be the first one started by, or will be starting by, the South Asian community, actually specifically Indian community. And the center will focus on primary care services, preventive services, chronic disease management, patient education. So these are the 4 criteria our new health center, community health center, will be starting. And ultimately we hope to create a healthcare home for uninsured populations in Central Jersey, where they can receive continuous high quality health care at a center where they don't have to worry about any finances. Now let me mention one thing also, that if they have Medicare, Medicaid, we should be able to accept those insurances. In the future we may accept private insurances, but right now we'll have 3 structure: Medicare, Medicaid, or sliding fee scale. So if they can afford a bill, they will be charged $10, $20, $30 depending on their financial condition. So this is going to be a huge step. For the last 3 years our team has been working diligently, and finally this 2026 we hoping, actually we are getting the key for our clinic this weekend. And
Congratulations.
yes,
Yes.
thank you. And we are hoping that within next few months, 2 to 3 months before summertime, we should have functioning clinic where patients can walk in, make the appointment, and we'll have definitely community collaborations with local hospitals for other services, but at least the primary care we should be able to provide with our Health Camp of New Jersey Community Health Center. This is the first one, and I'm so thankful to our team, Health Camp of New Jersey. Mr. Kiran Kothari is our Board of Trustees chair, has been with Health Camp of New Jersey for 28 years, and we are so thankful for his time and our members who have been dedicated their services selflessly, without taking any penny, without putting any expenses on Health Camp of New Jersey. So congratulations to the entire team.
And let me just add one more thing. It's phenomenal teamwork, and we all do our part. Our team has such, we have expertise in different areas. We have people who are experts in finance area. We have people who are physician like Dr. Patel, who leads the entire clinical side of it. We have cardiologists, and they are so dedicated, and they come and provide services, and they will continue to provide services ongoing. So this step is so groundbreaking for our community. I think Dr. Patel and I have talked about it for next at least 10 years or more. Over 20 years ago, people had this vision, but
Yeah.
now finally we are putting it in action. And so it's an exciting moment, not only just for Health Camp of New Jersey, but for our entire Indian community.
Definitely. A huge congratulations to you and your team. It cannot be done without, like you said, without your team of volunteers, professionals, whoever is involved, in bringing your vision to reality, right? So you mentioned, and you've mentioned this while you were sharing your journey in the past. You've mentioned about incorporating telehealth and group therapy as part of your future services, right? How do you see this helping the underserved communities access, maybe share a little bit about that?
Yeah, so many, we are past quarter century in 21st century. We are in 2026 now. It's a digital world. It's not like when I started practice back in 1990. Now it's a different thing, different story. It's all digital, EHR, telehealth world, and has a potential significantly improved access to care for so many. Those patients who can travel can be seen by telehealth, or they face transportation barriers or work schedules or childcare responsibilities. With telehealth, patient can consult with healthcare providers just a phone call or a computer click away. So those are the comfort from their homes, which makes healthcare more convenient and also becomes more accessible for those individuals who cannot access the healthcare by going to the doctor's office. So it's very important that access is easily available, just a phone call or a computer click away. And one other thing regarding, you mentioned the group therapy, right? So group therapy is very important aspect we are exploring, because if we have few patients who are not controlled with diabetes, or if they have mental health issues, those supports can be provided by education. We are not talking about treating them, but providing education on a general basis. So at least they have support from each other, and they understand much better when they are with the similar kind of patients or individuals. So I think more people can get the services, and the comprehensiveness is always there when you have a group therapy.
And you're launching this in Kiran, you would like to add anything to that?
No, go ahead. I was actually going to ask Dr. Patel to maybe give a little more detail about what's a lookalike and the FQHC clinic is and what we are doing.
Yes.
Because that's really important for your viewers and our community to know.
So the ultimate goal is to get the approval for the federally qualified health center or the health clinic, which gives us the federal funding on a regular basis. So we don't have to look for the private funding. So that is the initial application that will go federally qualified health center / look-alike clinic. So within 6 months, we will get the approval for the look-alike clinic. So look-alike clinic means, LAL means, you will not get the federal funding at this time, but you should be able to apply for the federal grants, corporate grants, because you are a qualified agency now or a qualified organizations where you can receive the funding. You will not be able to get the federal dollar funding from the federal government at this point, but the ultimate goal is to have this federally qualified health center, which will be the first one ever for our community. And we are so proud that I'm very confident that within next 2 years, we should be able to obtain that title, FQHC. And I think at that point, we should be very thankful to the God that God has given us this opportunity to serve our community, keep our legacy going, because I think we will not be here forever. And I think our young generation needs to take this to the next level.
Definitely. I'm sure the way you have put it all together, you are there. Like within next couple of years. I mean, you'll get it what you're looking for.
Yeah, so what that means is if we do not have enough patients who are insured and we cannot really get any reimbursement, we still have to function and provide the services. So really our community support is gonna be needed for at least, I would say, almost 2 years. Is that right, Dr. Patel? Right? So
Yes.
they have been supporting us, and many have supported our health camps because all the cost of health camps, we do not charge patients anything. But all the tests that are done, there is a cost to it, which was supported by private donors. And so we'll continue to look for that kind of support on an ongoing basis until we have the federal qualification.
Okay, got it.
I also want to add one more thing. So in last 27 years, we have done only 3 fundraising events. Unlike many organizations, they do fundraising every single year. We are so thankful to our donors for coming forward without asking, and our community is so good to Health Camp of New Jersey. I can't mention all the names because it will take the entire day, but I'm so thankful for all the community supporters who has helped us tremendously for the past 27 years without asking for any help. And I think if you count their volunteer hours, probably millions of dollars is came from those individuals. So thankful to our community, and I would say South Asian communities, American communities, all you name it, all came forward to help us.
It is such a noble cause, right? I mean, I'm not surprised that you are, got so much support from all communities. You're doing a great job. I mean, congratulations and wishing you all the luck, right?
Thank you.
So we have worked with HCNJ for your fundraisers, and we look forward to volunteering or helping you guys even in the future. Could you talk a little bit about your experience with Vibrnz and how we could further help you, in your mission?
So I can tell you, I have been working with you for past few years, not only with Health Camp of New Jersey, but so many other organizations. And working with Vibrnz has been very helpful in modernizing our event management, fundraising efforts. Your digital platform has simplified the process of ticketing, event promotion, donor engagement, and so many other avenues which we were not doing it before. It allows our supporters to easily learn about our events, purchase tickets, contribute to our mission online. In today's digital world, I think having the right technology, partnering like you, helps organizations like ours focus more on our mission while making it easier for the community to participate and support our work. So we are so thankful to you, Minnie and Vibrnz. Your responsiveness, your dedication, and your timeliness is very important to us. And we are so thankful we found you and we're collaborating with you for Health Camp of New Jersey.
Look forward to working with you even for any of your initiatives. And we have learned a lot from you. Over the years, we have improved a lot. You've given us feedback, and it has been a wonderful experience. Both Dr. Tushar and Kiranji, working with you and your team. Yeah. So my final question, any other comments before I ask you the final question? Anything you'd like to add?
No, I just want to say that the initiative that we are about to launch, it is so exciting and thrilling, and it is going to be so important for our community that I cannot even express in words. It's going to be phenomenal for anyone who has. What we will be doing is we will be bridging the gap between those who have insurance and those who do not. And that is so important, especially not just our community. And this clinic is not just for Indian community, it's for anyone who wants services they can walk in. So we are not only serving the South Asian community, but the entire local community. And that's the more exciting part for us.
Yes.
Also, I would like to add one more thing. I sincerely urge all our physician community, nurses, nurse practitioners, physicians, and all allied healthcare professionals to come out and support. We need volunteering for the health center because we'll be open from Monday to Friday, 9 to 5. So it's going to be 40 hours every week. And us, like board of directors, cannot get a penny for this project. So we still be working free of charge. As many volunteers as we can get, we have to reduce the cost of pay to the individuals. So of course we have to pay some individuals, professionals who come and work for us full time. But if we get some volunteers, that would be very, very helpful to our mission and a long-term goal.
Sure, and the next question or the final question is exactly on those lines. So for the viewers who are inspired by the work of HCNJ and your entire team, how can they get involved and support your mission? Anything specifically or in general?
So my cell phone number is very, very public. I have no restrictions on my cell phone. I get phone calls every day, 10, 15 brand new phone calls from the community for help. My phone number is 848-391-0499. My email address is president, president @ihcnj.org. I'm on Facebook. I'm on LinkedIn. They can go our Facebook page, Health Camp of New Jersey. We have a group, we have a page. They can find us anywhere, and I think through our health camps they can come work for health camps, providing their service and get additional volunteering hours for the community health center project as well.
Sure.
So if you want to support, we say in India, tan, man, and done. Over here, they say, time, treasure, and talent. So any of those things we can use in this respect, we will welcome it. There are hundreds of them already helping us, but the need is going to grow because in addition to doing the health camps we have been doing, now we have a full-scale clinic with a 40-hour, team that we're going to need. So if you think this is an important mission and if it's touching your heart and you want to help those who do not have insurance, and things are not going to get any better because healthcare in the United States is getting harder and harder to get the services. So if that's important to you, then come and join us. Go to our website. I think we already mentioned it, and reach out to us. Tell us where and how you want to help, and then let's talk.
Definitely. Thank you so much for your time, for being here, sharing your vision, sharing your goals, what you've done, your journey. It has been such a pleasure talking to both of you and wishing you all the luck. Your new initiative.
Thank you so much, Minnie.
Thank you very much, Minnie. We really appreciate what you do for our organization as well. Thank you.
Thank you so much.
Thank you so much.
It's truly commendable, and I look forward to helping in whatever capacity I can, whether it be as mayor or just as a friend or a colleague, making sure that the federally qualified health center that you are working towards, or a comparable one, starts right here in New Jersey and hopefully in Edison. Once again, thank you all for doing the type of work that you deserve. I'm truly humbled and honored to be here. Thanks again.
My name is Dr. Tushar Patel, President of Health Camp of New Jersey. On behalf of our executive committee, trustees, and the entire team, it is my immense pleasure and honor to host you all for our 25th anniversary gala here at Balaji Temple in Bridgewater. As we approach the quarter-century mark of the 21st century, our healthcare challenges are growing immensely. And as we all witnessed during the pandemic, we lost our focus on preventive healthcare over the last 3 years. Thankfully, we are back on track, but access to the healthcare system for uninsured, underinsured, and underprivileged individuals is still very challenging. And we all collectively need to work toward collaborating our healthcare delivery system and efforts to provide basic health screening to detect chronic diseases earlier for timely interventions and better outcomes and to reduce healthcare disparities in our community. So at this milestone event, we are committed to starting a new initiative, opening a community healthcare center in New Jersey. The Community Health Center project will be in collaboration with our community leaders, partnering organizations, and healthcare institutions in New Jersey and beyond. This is not an overnight idea, but a well thought out and carefully planned idea. I remember a meeting held with few of our healthcare leaders across our community about 15 years ago to start a community health center focused primarily on South Asians, but unfortunately it did not materialize that time. It is clear now, time is now, as the healthcare disparities are at their highest levels across the nation, and New Jersey is no exception. With your support and a team of strong, dedicated, and hardworking professionals, we are ready to take the challenge to meet our goal of a community health center opening in New Jersey by December 2026.